So, good morning, afternoon, evening, whatsoever. Early clinical exposure. Through this, we are going to do this competency related to nutrition. Your patient is a malnourished man with extreme weakness and swollen feet. And early clinical exposure in the competency based curriculum, it is an important component, as you all know, and it is studying clinical problems through basic medical sciences, or better perhaps, studying basic medical sciences, biochemistry at the backdrop of a clinical problem. So, our clinical problem pertains to a man who is malnourished, extreme weakness, swollen feet, and he is 52 years old and comes from a poor socio-economic group. There is listlessness, unwilling to do anything, loss of appetite and weakness, as we said, extreme form of weakness is there. Heaviness of the legs, pin and needle sensation, and he gives a history of frequent alcohol intake. Loss of, so this is paradoxical, comes from a poor socioeconomic group, malnutrition, but taking lot of alcohol, finding money to spend on the alcohol. We are going to discuss that is hallmark of an alcoholic. Loss of sensation over tibia and muscle weakness we talked about. There is muscle wasting on examination, patient having ataxia, muscle coordination भी defective है. Tachycardia, increased heart rate, distension of neck veins, moderate edema as we talked about, and an important feature, memory loss and mental derangements are there. So it is not a simple straightforward case of malnutrition. There is something more to this also, because simply on the basis of protein calorie malnutrition, we cannot explain all these findings. Lab reports, they are revealing hemoglobin कम है but इतना नहीं है to account for all the symptoms of the patient. And pyruvic acid level in the serum is elevated, lactic acid level also, low urinary excretion of thiamine, a water-soluble vitamin B1. So that points towards B1 deficiency. Some other findings, transketolase activity is low, and on X-ray examination, cardiac enlargement is there. Further confirmatory tests were carried out. We are going to talk about them later on. So now, just after this, a very fast progress of the lecture, let us now pause and examine some of the important points and try to explain them. What is number one, your most probable diagnosis? So, as we said, urinary excretion of thiamine is low. So, that points towards thiamine deficiency. So, B1 deficiency, that is the most probable diagnosis. We are going to confirm it later on. So, most probable diagnosis is B1 deficiency. Second question, what is the underlying cause of extreme weakness? In fact, Beri Beri, it's a singular word, singular Sri Lanka की language है. The word means Beri Beri. I cannot, it translates it, implying that the patient is so weak that he says, I cannot, I cannot. He cannot do anything, sort of. So extreme weakness is there. So what is underlying cause? Can we explain this extreme weakness on the basis of B1 deficiency? So question 2, why extreme weakness? Because B1 is an important coenzyme in the major energy yielding pathways of the body. Major energy yielding pathways are depending on thiamine pyrophosphate, glucose से बना pyruvate, glycolytic sequence, then acetyl coenzyme, the link between glycolysis and TCA cycle. So pyruvate to acetyl coenzyme, this conversion is catalyzed by a multi-enzyme complex called pyruvate dehydrogenase. And thiamine is an important component of this multi-enzyme complex. Oh my God. Just, I'm sorry. So pyruvate dehydrogenase is an important component of this multi-enzyme complex. So अगर pyruvate dehydrogenase defective होगा, this reaction is going to be blocked. Then in TCA cycle, there is an important multi-enzyme complex called alpha ketoglutarate dehydrogenase. इसका भी thiamine important coenzyme है. So thiamine deficiency में this enzyme will also be blocked. तो अब net result क्या निकला आप देख लीजिए. Pyruvate to acetyl coenzyme conversion is gone or TCA cycle is also blocked. So the major energy yielding pathways undergo a block. Sluggish हो जाएंगे, block हो जाएंगे with the, I should not say block, they become sluggish. तो उससे क्या होगा? Major energy produce नहीं, and no wonder the patient will feel Beri Beri. I cannot, extreme weakness will be there. Now we come to question number 3. Biochemical changes that lead to edema, dilatation of neck veins and cardiomyopathy. So edema. एक इसके अंदर आप ये देखिए, अभी हमने जैसे डिस्कस किया था, पायरुवेट to acetyl coenzyme conversion is blocked or sluggish. इससे क्या होगा? सीरम पायरुविक एसिड लेवल बढ़ जाएगा. Now, major pathway of pyruvate catabolism is blocked, so it finds an alternate route and it is getting converted to lactate. Okay? So lactate is also increasing. So क्या होगा? Acids are increasing, pyruvic acid and lactic acid. तो उससे फिर क्या होगा? Vasodilatation हो जाएगा, because these acids are vasodilating in nature. And then उससे क्या होगा? उससे dilatation, तो यहाँ जो dilatation of the neck veins also will be observed. Okay. Now, one more important point, dilatation of neck veins will be there. There will be increased venous return to the heart. तो हार्ट पर ज्यादा प्रेशर पड़ जाएगा, with the result that over a period of time the heart will be enlarged. This is what we call cardiomyopathy, and not infrequently the patients undergo high output cardiac failure also. So I will just explain this thing once more at the cost of repetition. Pyruvic acid is converted to acetyl coenzyme by pyruvate dehydrogenase. The reaction is blocked. Pyruvic acid concentration build up, elevated, and lactic acid. Pyruvic acid accumulated with pyruvic acid is converted to lactic acid. Okay. Now, lab report. So anyway, we will be talking about that later on. Question 3 हमने कर लिया. After that, another lab report we had seen, trans-ketolase activity is low. Can we explain this on the basis of B1 deficiency? Yes, we can. Because B1, thymine pyrophosphate, is an important coenzyme for oxidative decarboxylation reactions. We saw just now pyruvate to acetyl coenzyme, alpha ketoglutarate dehydrogenase. That is number 1. Number 2, it is also important coenzyme for an important erythrocyte enzyme called trans-ketolase. So अगर B1 deficiency होगी, trans-ketolase activity will also fall low. Now, fourth question. basis of confirmatory test. Let me go back to that slide. So erythrocyte transketolase concentration is low. Confirmatory test हमने क्या किए थे? Number one, if you give glucose load, pyruvic acid and lactic acid concentration will rise. That was confirmatory test number one. Why does that happen? After glucose load, why acid concentrations are increasing? So we are going to see now what are bases of these two confirmatory tests and up. So first is after glucose load, why acids are increasing? Because ज़्यादा आप ग्लूकोज लोड दोगे, ग्लूकोज will be converted to pyruvate, pyruvic acid load will increase. But the patient is having limited capacity to further metabolize pyruvic acid. So they will be shoot up in the pyruvic acid concentration. That is consequent basis of this. The lactic acid also will increase. After injecting thiamine pyrophosphate, if you estimate transketolase activity in the RBC, what do you expect? Should it fall or should it rise? It will rise, isn't it? Because TP, thiamine pyrophosphate, is an important coenzyme for this transketolase. So TPP deficiency की वजह से transketolase activity was low. So if you inject PPT, TPP, thiamine pyrophosphate, there is no wonder that transketolase activity will rise. So this is the basis of the fourth question का answer है basis of the confirmatory test. We have been talking a lot about transketolase. So let me entertain a little bit of digression before we come to the next question. Transketolase क्या करता है? HMP shunt pathway की phase 1 में hexoses are converted to pentoses by a series of irreversible reactions. In the stage 2 or phase 2, T5 are reconverted to C6, C5 to C6 by a series of reversible reactions. So two enzymes are required in stage 2, transketolase and transaltolase. We have been talking about transketolase, so I won't go into detail. Reaction, ये देखिए transketolase is required. In reaction 3, transketolase is required. Details are shown here, but not required at this stage. So now we come to question number 5. Patient is having alcohol also. Patient is addicted to alcohol. He cannot do away with that. He sacrifices his food in order to take alcohol. So does it have any effect on patient symptoms? Does it aggravate this Beri Beri? His patient symptom, I cannot, and various other symptoms also? Yes, it does, by two ways. Number one, to bada simple. Number two, very simple. Alcohol decreases intestinal absorption of thiamine. Second point needs a little bit of elaboration. As you all know, alcohol is not only an intoxicant, it is a nutrient also. 7.1 kilocalories per gram it provides. But this patient who is taking alcohol, तो उसका कैलोरी रिक्वायरमेंट तो नियरली फुलफिल्ड हो जाती है या थोड़ा डाउन रह जाती है, बट कैलोरी रिक्वायरमेंट फुलफिल are fulfilled to some extent. But what about his micronutrient requirements? अल्कोहल तो कोई ऐसा नहीं है जो फोर्टिफाइड है विटामिन और मिनरल्स के साथ, isn't it? It is not. So this is called empty calories. कैलोरी मिल गई लेकिन माइक्रोन्यूट्रिएंट डेफिशिएंसी हो गई. So that is why अल्कोहल को बोला जाता है empty calories. Okay. As I said, I saw a smile on the faces of people sitting around. But please remember, alcoholism and obesity these two are actually malnutrition states. So that's a question for you. Why obesity is called malnutrition state? Why, empty calorie I have talked about. Now, not directly, our patient is suffering from Beri Beri. These two disorders, Wernicke's encephalopathy and Korsakoff psychosis, these are seen in alcoholic. Alcoholic, I repeat, who prefers alcohol to food. But this is seen in the developed nation. In the developed nation, Beri Beri is non-existent. If you see the Western textbook, they write about Beri Beri once upon a time. ऐसा होता था. Although in the developing countries, poor countries, it is still prevalent, but not in the developed world. वहां पर alcohol intake leads to Wernicke's encephalopathy and Korsakoff psychosis. We will be discussing at some other time. The underlying feature is B1 deficiency. So symptoms nearly same honge, but in the chronic stage of Wernicke's encephalopathy called Korsakoff psychosis, this I found future medical doctors should be interesting for you. Antegrade amnesia, forgetfulness. Patient remembers distant events, लेकिन अभी क्या हुआ वो भूल जाता है. And the second is cannot transcribe short term memory to long term memory. तो आपने इसका पढ़ा ही होगा, देखा होगा. शुरू में जो होता है क्या सेशन, उसको क्या बोलते हैं, 2 वीक सेशन जो होता है फाउंडेशन कोर्स में. शॉर्ट टर्म मेमोरी, लॉन्ग टर्म मेमोरी, जो आपका एफरेंट जा रहा है वो बोलते हैं शॉर्ट टर्म मेमोरी. दैट गोज इनटू योर शॉर्ट टर्म मेमोरी, but gradually your brain processes it and it enters the long term memory. You get so many afferents, you don't remember everything. जो लॉन्ग टर्म मेमोरी में ट्रांसक्राइब हो गया वो याद रहता है. तो ट्रांसक्राइब, दिस इज डिफेक्टिव इन द पेशेंट. So that is why we saw that mental derangement. So that explains. That cannot be explained on the basis of Beri Beri, but his alcohol intake has precipitated this condition. Fortunately, our patient has not reached this chronic stage. So I think we have discussed all these questions. तो एक आपको मैं क्वेश्चन दे दूं. There is something called wet berry berry and dry berry berry. अभी तक हमने जो देखा, पेशेंट में दो तरह के सिम्टम्स है. नंबर वन, न्यूरोटिक सिम्टम्स. वो था ना पायरुवेट टू एनर्जी यील्डिंग पाथवे. And since nervous system is heavily dependent upon glucose, heavily dependent, not exclusively, heavily. So nervous system is predominantly affected. So neurotic symptoms उनको बोलते हैं dry berry berry. और wet berry berry में क्या है, हमने देखा था कि एसिड वगैरह बढ़ जाते हैं. एसिड बढ़ने से फिर क्या होगा, इडीमा, नेक वेन, कार्डियोमायोपैथी, high output cardiac failure. So that is all wet berry berry. But these are actually, parts of a spectrum. You cannot actually, discriminate. You cannot actually, सर्जिकल स्कैल्पल से उनको आप डिफरेंशिएट नहीं कर सकते. और थायमिन की, नाउ यू सी, जस्ट फॉर कॉन्फर्मेटरी थिंग, sorry, not confirmatory, we have discussed the salient features related to B1 with the help of that clinical case, the early clinical exposure. Just for completion sake, ये thiamine क्या होता है? It is a comprises of two components. There is a thiazole ring and there is a pyrimidine ring. Thiazole ring may be pyrimidine ring, and they are linked together by a methylene bridge. Methylene bridge say they are linked together. So this is thiamine. What is thiamine pyrophosphate? Gives me an opportunity to tell you that B1 vitamins are important coenzymes, precursors. They are not coenzymes per se. For example, thiamine, it is converted to thiamine pyrophosphate. So now it is an important coenzyme form. Likewise, for example, niacin, vitamin B3, उसका क्या है coenzyme form क्या है? NAD, NADP. इसी तरह से राइबोफ्लोविन का coenzyme form क्या है? FAD, FMN. ऑलराइट, इसी तरह से पेंटोथेनिक एसिड का क्या है? क्या है पेंटोथेनिक एसिड का coenzyme? Okay, find out. It is actually anyway. All right. So that I conclude. I'm sorry for the interruption. The vitamin of the B1 group, they are precursors of important coenzymes. For example, thiamine is precursor for thiamine pyrophosphate. RDA, recommended dietary allowance. I think it is 1.5 milligram for an adult. But an interesting point, that's why I brought out this, कि देखो, thiamine is mainly required for energy yielding pathways. So more is the calorie intake, more is the TPP B1 requirement. तो इसको mostly हम बोलते हैं, I think, 0.9 milligram per 1000 kilocalories intake. Now, you being, if I'm addressing to some MBBS student, तो count कि आपको कितना कैलोरी इनटेक आपका रोज को होगा. कैलोरी इनटेक comprises of three components: BMR, specific dynamic action and muscular activity का. अगर आपका 2500 है तो कितना आपका थाइमिन का इनटेक होगा, RDA होगा. This is where most undergraduates make mistake. Thiamine, thiamine. Are they same or are they different? Spelling is different, primary structure is different. But kya hai? This is a pyrimidine, this is a B1. There is an enzyme called thiaminase. So thiaminase, ये कहाँ present होता है? In some fishes. तो क्या effect होगा इसका? It may precipitate thiamine deficiency. Alcoholism, we have already talked in detail. We may talk some other time. Wernicke's encephalopathy, the acute phase, and the Korsakoff psychosis. All right. So we conclude with this. Some questions which I have given you, please take them very seriously. I mean, because that is part of self-directed learning, and that is much more important compared to passive learning. जो मैंने आप बोला आपको वो passive learning होगी, but what you will learn by yourself, that will be self-directed learning. And finally, I thank Dr. Edelbert for providing all the support everywhere. Thank you so much.